today I had my cast taken off, as you can see. I was going to do a video with everything taken off, but he recommends while while I can in the evenings or whenever, and it's evening now because it took me a while to get home, to do a piece take. I've gone a bit overboard because I knocked my nose earlier. I know that's a bit of a bummer, so I thought I'd put some extra on just to make sure it helps. But apparently having the tape on, because obviously the cast was on, when you take it off sometimes it can swell a bit more, it hasn't got that thing to put it in place. So he recommends getting a bit of tape, one there, these are the overboard bits, one there, and you chase it all the way down your nose, and then scoop it under and go back up, and it kind of supports there and supports the tip and holds it up, kind of thing. So that's meant to help with kind of making sure it doesn't obviously swell more where the cast isn't there anymore. Yeah, so my experience of having the cast taken off, obviously I was really looking forward to it, because obviously you can't scratch your nose, especially if you get like a little itch there. It drives you crazy where you can't get to it. And obviously the amount of blood I had in my nose was really uncomfortable. It wasn't painful, it was just annoying more than anything. So I've been looking forward to it being taken off. So I went there and I had the cast taken off first of all. It took a bit of a while to get the tape off, because obviously where it had been there for a few days it got really sticky, and took a bit of prying. So I got that taken off. It felt amazing having that cast taken off. Like, the only way I can describe it is if you have like a really uncomfortable tight pair of jeans and you get home and you strip them off and you feel free. That's how it feels, you know, your cast taken off. So that was great. That wasn't really painful at all. It was a bit kind of like taking the tape off, because obviously it was really sticky, but it wasn't uncomfortable. Then he took the stitches out. I'd never had stitches taken out before. Well, not that I can remember anyway. Maybe when I was little, but I don't remember it. And I didn't even realise. I thought it was going to be a lot more painful, just the idea of it. But no, it was like, just as he does it, like a little pinch, basically. It really wasn't that painful at all. It was just kind of like, what did it feel like? Like having a splinter taken out, kind of thing. Well, it felt fine afterwards, but in the actual process it was kind of like, oh. So no, it was fine. I would not be worried about having stitches taken out again, because it didn't hurt. Just a bit of a pinch. So I had those out. And then he started taking the blood out my nose, because obviously I had quite a lot, and as he was taking it out he said that I had probably more than usual. I don't know why. I've never had a nosebleed before in my life, so maybe it just kind of, my body was having a bit of a strop and thought, oh, I've never had one before, I'm going to give you loads this time. So I'd say taking the blood out your nose is the most uncomfortable, just because you've got loads of tiny hairs in your nose, and where the blood's been there for a few days and it's dried up, it's kind of clung onto those little hairs. So as he's taken it out, it's kind of like having a wax, basically. So it's quite pinchy, like, it's bearable, but it just kind of, you have to kind of grit your teeth, kind of thing. Just because of the little hairs, it's sensitive. But after you've taken it out, it's so nice. I can breathe out my nose, and it just takes all that uncomfortable kind of feeling away. Because it's like having, because it felt, I know it probably wasn't, but it felt like I was like blocked up with blood all the way up to here. So it's really uncomfortable. So when it's taken out, it's really nice. So that was good. I say the only uncomfortable bit was my nose isn't that numb. I mean, there. I can feel it. It feels around there. I can feel it, but it just feels like I've got a little bit of, it feels like I've got clean film over my nose. Like the end, not a painful part, but like the start of pins and needles kind of thing. So I can feel it, but it's just a little bit pins and needly. Nostrils can feel perfectly fine up there, perfectly fine. It's just that little tip right there. So unfortunately, I'm not that numb. So having the medicine, the injection in your nose to encourage the swelling to go down and like heal faster, all that type of stuff, that he does for rhinoplasties. That was quite painful. It didn't last very long, but I definitely had to like kind of squeeze my hand a bit. He only did it 3 times, and he did it quite quick, so it wasn't a long-winded experience or anything. Just, I think he did one at the top, one slightly lower down, and then one slightly lower down. That one was probably the weirdest because I felt like when the liquid went in, it got a bit of pressure where, I know it's a very small amount of liquid he was injecting, but obviously because it's not normally there, you feel it. So it was a weird feeling. It wasn't painful, it was just weird. So yeah, that was fine. Took the needle out, and it wasn't like it throbbed afterwards for ages, it was just in the moment kind of thing, so really wasn't that bad. Yeah, so I had that done. He gave my face a bit of a scrub where I had like kind of, it looked like the iodine and like kind of the stickiness of the tape that'd been on my face off. Just basically made me look a bit more presentable. And got all the blood like around my nose, so did that, and then he let me have a look at kind of the semi-final result, because obviously the tip is still quite swollen compared to where it will be, and apparently that will go down even more considerably than it already is in the next, probably, I think he said 2 weeks, and then obviously the final result will be more like 6 to 8 weeks, which isn't that big of a deal because even at the moment it's smaller than what I had in the first place, so you're not going to complain, are you? But I could tell the bridge wasn't as swollen, because that looked quite what I'd expect the final result to be. So I was really happy with it. I mean, it was a weird, I think it's going to look weird when you first look at it, because it looked weird when I first looked at it in the mirror, and for a little while afterwards. But now I've been looking at it for a few hours, so I got home, I love it. First of all I was like, oh that looks nice, but I don't know if it suits my face. But it was just because obviously, it's like when you dye your hair a different colour, really radical colour or something, and you first see it and it's like really new, it's a bit kind of like, oh, is this a bad idea? And then after you've seen it a few times, you think, oh no, actually I love it. Like, it kind of settles in. So no, don't regret any of it, absolutely love it. Just can't wait to see the actual proper final result when the swelling goes down. What else is it? He advised me to continue to next week to kind of, I can walk around, I can do things, but still like kind of take it relatively easy. I think Dr. De Silva said that it's possible I could have a nosebleed in the next few days, because obviously it's him taking the blood out has kind of irritated it a bit and stuff like that. So just take it easy kind of thing, but basically general advice. Not to do any exercise for like the first while or whatever. And yeah, just kind of be sensible basically. So I start my new job on Monday, so it'll probably still be swollen then, but like he said and I said, if it's a new job and it's people you don't know, or if it's people on the street, people aren't going to notice. And obviously people, if they're staring at me, will notice, because it's still a little bit raw around there. I don't know if you can see. Oh, I've got to tape it away. But yeah, it's still a little bit pinkable. Basically, it's like when you first pick a scab off, it's still a bit pink where the skin's fresh and like still a little bit bloody. But from a few feet away, you'd never notice. So that'll go down. He's recommended me just for tonight to put on the ointment stuff that you'll be using on your wounds. And then tomorrow he said that I can wear makeup, as long as obviously I take care and I clean it off before I go to bed and all that type of malarkey, just general hygiene. Then I can wear makeup on it, which is great, because even if there's a red mark and it kind of looks like you've had a cold, that's how I think it looks, and that's how my mum described it. Then you just cover it up with makeup and nobody'd ever notice. So yeah, just take general care with it, and it seems like it's fine. I'm really happy with what he's done. Just kind of want to wait to see what it looks like, the final result, in the next 2 weeks when actually the swelling goes down. I think it's gonna be changing all the time, so it's gonna be quite cool. But yeah, the only kind of downfall today was when I got home. Typical, as soon as I get the cast off, the whole week I haven't rolled over in my sleep, I haven't knocked it, I haven't like tapped it or anything. No problems at all. And I accidentally turned as my boyfriend turned and whacked my nose into his shoulder. But I think because obviously I'm paranoid about it, I moved back really quick, so he only lightly tapped it. But obviously, because you're thinking about it and you're paranoid, I react quite dramatically, got a bit emotional, thinking it was worse than it was. I was like, oh, is my nose straight? What have I done? Ah! Getting really panicky, but it was fine. I just over-exaggerated, basically. So I gave it a wash, put my ointment on, and then strapped this on. And I mean, obviously, if I had done any real damage, I'm sure it would have blown up pretty big, or like swelled up or something. But it hasn't changed, and it's not painful, so I'm pretty sure I haven't done anything to it. I'm sure, like anything, if you bash your knee hard enough and you get some damage, it's gonna swell or bruise. Haven't got anything at the moment. Fingers crossed I won't tomorrow. So yeah, everything's so good so far. Just looking forward to the next 2 weeks, which I'll do daily videos the next 2 weeks. I don't know how much I'll be able to say, so I apologise if I have a few days of videos of me just kind of, hey, bye, because there might not be anything really to say, but just so you can get a visual example of how it goes day by day. You might notice it, and I might notice it when I look back on it, but who knows. So yeah, see you tomorrow. Hopefully I won't have loads of bruising from my ridiculous experience of stupidity. And yeah, see you soon. See you on day 9 of recovery.